Stay seated to the last plus I'm second.
Yes.
Bill, did you get the answer to your question?
Yes.
So I was gonna say, if you didn't, your information's probably out there on the third row. They would know. All right. We'll begin this morning with a pledge of allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the May 6th Shawnee County 2024 Shawnee County Work Session. My name is Kevin Cook. I serve as the chair this year. Joining me today is Commissioner Aaron Mays. Good morning.
Morning.
Commissioner Bill Rippon. Good morning.
Good morning.
And then this morning we are going to have a presentation from Civic regarding their grant and what impact they're having within our community. So Danielle, I'm going to turn it over to you and kind of let you talk a little bit about Civic and what's going on.
Thank you. I appreciate you taking time to have us here today. We have several members from Civic, which is Community-Inspired Violence Intervention Coalition. So we really formulated very quickly and have had a lot occur in the last several months. At the end of October, when we were all experiencing a lot of uncertainty and grief over the violence that our community was experiencing, we really rallied together to kind of talk about what can we do? What are some things that we can maybe bring to the table to make an impact in our community? And rather quickly, a couple grants came our way. After only meeting a few times, a grant from NACHO, the National Association of City and County Health Officials, with funding from the CDC, came on board with a very quick turnaround, and we found out very quickly after that that we were one of 4 cities across the country that was selected to receive this grant in technical assistance. So many of our team just returned from being in Aurora, Colorado last week with the CDC, with NACHO and other national organizations, where we were able to get a lot of one-on-one time with development and planning. They've provided a lot of technical assistance in this process as well, and we made a lot of connections on ways to move forward with implementing the program. Around that same time, we also did find out about a Department of Justice grant that was awarded to our state. Not every state did receive them, but our state was one that did receive some funding to implement specifically a community violence intervention program. Shawnee County was actually named as one of the 3 counties within the Department of Justice narrative as being a county that had a very high rate of violence without a evidence-based program to really help combat it. So we took that as an opportunity to say, let's try this, let's do this. And we spent a lot of time getting that grant together with the data and the information and the research-based evidence programming to go into it, and found out within the last couple weeks that we were one of 3 recipients to receive some of that funding for our community. So that will assist us in implementing that national programming to do that technical assistance, as well as support some actual positions. However, there is a lot of sustainability and other pieces to that puzzle that we will continue to be working on to help get that funding and sustainability and partnership that we're really looking for across the board within our community to make this really successful. So we've been able to get a lot of wonderful organizations, many county organizations who have been able to come to the table with a range of expertises that are doing the work every day. So we have several community members that are doing work on their own, as well as, like I said, organizations that have been staying steady and true to committing to community work and reducing violence, providing resources to people in our community that we all know play that part. We still have a lot more to do. Like I said, things have been really, really rapid, and we have a lot more connections that we want to build. as this process goes forward. We have a lot that have come to the table, but we have a lot more that we need to be making those connections with. And that's part of this process too, wanting to make sure that we're reaching out, providing information, bringing people to the table that can offer different components of this work that is really utilizing a public health approach to reducing violence. So our mission is to develop an evidence-based, community-led violence intervention program using that public health approach that addresses the root causes of violence, interrupts conflict, and supports those who are at most risk to experience this violence. So our team posits that violence is, in Topeka, Shawnee County, a manifestation of generational disenfranchisement that really harms the Black and brown citizens disproportionately. We can see on this map, which is a map that's used to kind of identify some places within our community that don't have as many opportunities or maybe under-resourced. And it gives us a starting point to really look at how do these social determinants of health factors overlay with where we see violence, and how can we start making intentional efforts in those specific areas. And we know that this has been an ongoing problem. In our community, I don't need to really probably repeat those numbers that we all felt last year, with our homicide rate being at its very highest. And we know that violence ebbs and flows. We see that cycling, but to have 31% of our victims last year be under the age of 18, it really hits differently when we know that there's maybe more we can do. So the public health approach to approaching violence is looking at violence as an epidemic, like a disease, and addressing it much like we would a disease. So looking for that point, like where's the center? Where's the center of this conflict occurring? Like a disease of where's this first contact? And then providing very intentional approaches to addressing that outbreak so that it doesn't spread. And we know that it becomes a norm once a community makes an everyday occurrence of hearing gunshots, or knowing that this is what they're experiencing because this is how it's always been. We need to be able to provide the opportunities to change that narrative as well. We need to be able to provide community the resources they need to work on helping community helping community, which is a big piece of this. So this transmission of violence we look at as being exposure, modeling behaviors, and other norms, right? It just becomes the norm. And we recently did a survey where we had some questions really asking those experiences that people have within their community. And gunshots being heard every night was a pretty common reply that we received on this survey. We just ended it last week and haven't compiled all that information, but that really stuck out as I was going through that. And just as you can see, these clustering, that virus effect on that top graphic there, and assaults for Topeka, Shawnee County down at that bottom, you see that ebb and flow being very similar. So how do we stop an epidemic? We must interrupt that transmission, identify the threat, those who are at highest risk to experience that involvement or be involved in that violence, and use credible messengers, which are people from the community, people who know the community, who have grown up in the community, but also have lived experiences. They know that transition, they know what it's like to experience violence, or possibly even on the other side of having committed violence, and to have changed their pathway and now have that kind of unique ability to connect with people and help make that change. Preventing that future spread by changing behaviors of those who are at highest risk, being able to provide alternate opportunities that maybe are not easily accessible because of various barriers, and changing that group norm. So we want to move away from punitive approaches that tend to just cycle a lot more. I mean, we see that recidivism rate, right, continue to be there because we've tried that for so long that it's time to look at a new way of doing things. If the punitive approach was always working, we wouldn't be here right now. And so we need to look at alternate ways. So that kind of individualized approach to help them understand and help provide reduction of those barriers to access care and healing. So, I won't go through addressing all these root causes that go into it, but really social determinants of health are where we play, work, and live. The factors that really go into that. And we know there's very simple things too, right? And we have septet design, right? That we know that simply by painting boarded windows on houses reduces violence in a community, right? There's data that has supported that for a long time. And why not continue to take that further? Why not continue to take these efforts to improve these factors within these communities that are most impacted? And we see those disparities that are overlapping. Our 66604 zip code has had the highest infant mortality rate for years, right, in the entire state. We know the 66604 zip code tends to historically get reduction of as much funding and resources there currently. I think moving on to some DREAMS funding to support some things because they have continued to have a reduction in those resources. So we know that we can address some of these disparities that we see. We can assist people with accessing resources. We can bring together our community organizations to be able to be intentional about providing those resources to people as well. And so we know that, this is just a really good way to kind of visualize how these social determinants of health start building on each other and making it harder to kind of get out of cycles of trauma, cycles of violence, and how addressing these things can take out one more piece to that and provide a little bit more stability and hope and change within that. So currently, we have been engaging the community. We not only have this survey, but we also had town halls. So we went door knocking. We knocked on doors in the 3 communities that we were looking at, which was Central Park, Hillcrest, Oakland area is where we kind of started. And we knocked on doors, inviting people to come have pizza, come sit down with us, come talk with us about what they saw as barriers in their community, but really most importantly, what they saw as strengths in their community. Hillcrest, we had over almost 40 people attend. Central Park, we had over 60 people attend that town hall. In Oakland, almost 40 as well, which is really phenomenal, right? We had people who left their information with us with their skills. You know what, I can host knitting lessons on my front porch once a week. I'll bring the kids in, parents, they can come, or I can cook. I can teach people how to cook. Like the idea of I can build the strength within my community too, as we're all working together. And it was really exciting to see people come together to want to make that change. And I think that speaks to the fact that we're all ready, right? We have organizations who are ready. We have the communities who are ready to move forward. So we've been collecting that data in various ways. The CDC has been assisting with that technical assistance. We have another national agency that we will be working with tomorrow, starting kind of that more implementation of what that looks like. But we still have more. We need to be able to be working together city, county side to provide that data so we can be intentional. This is a very data-driven work. And continue to build that trust and collaboration. I think that more people who come to the table, more organizations who are also showing that they feel this is important by showing up at town halls and being a part of it is absolutely going to help build the trust that we have within the community as well. But for the main piece of it is we need to be hiring people who are in the community to continue to build that bridge for us as well, because they're the knowledgeable people of their community. And in the process of selecting that CVI strategy, that national strategy that is evidence-based, data-driven, which is where we're at this point. So that trauma-informed approach is something that we find to be very important. We work on it within our coalition. It has been built into some goals that we look at for our community violence interrupters, who, as they're trained to also build that collaboration with the community, they're also trained to mediate conflicts, to stop and help prevent that retaliation that we often see within groups and within violent incidences. So that trauma-informed approach is going to be really important, and we value that a lot with that support. We know that firearm violence costs our community an exorbitant amount of money. So this is a tool that is used on every town, economic cost of gun violence. They take into account the cost of living for your state and your community. And utilizing the numbers from last year, including the trauma registry report from Stormont-Vail, which does track firearm gunshot victims who come in and do not survive, and gunshot victims who come in and do survive. So we have both of those numbers from that registry. And this is an estimated cost to our community with the rate of gun violence we had last year. And then on the right there, seeing that economic cost that's driven directly to us as taxpayers. And what I find that this really tells us is that we can't afford not to do something. We can't afford not to be investing in an approach to reduce and to pivot from the current system that we are working in order to help people thrive differently. And it's in all of our interest that the cost, the ripple effect of firearm violence, gun violence, and violence in general is not just directly to that person, but we feel it ripple out to us all. So we're hoping that we continue to be able to spread that message of what these public health strategies really look like, how they can be impactful. We have been working on other opportunities to look at ways to remove some of the disparities that we see within that. We want to continue to build those relationships with city and county and other officials and organizations, and make sure that we're using an evidence-based, research-based approach where we will continue to receive that technical assistance so that we can keep fidelity within that program and make sure that we're implementing strategies that are known to be effective. So we've been very fortunate, like I said, to spend that last week in Colorado building on that information, and we're excited for that. So I'm happy to answer any questions.
Commissioner Whitcomb? Commissioner Mays?
No, but it's great. Keep up the good work.
So Danielle, you went to Aurora.
Mm-hmm.
You gathered information there about some of their programs. Can you talk to us a little bit about what Aurora maybe has done and what we might see being implemented in Topeka and Shawnee County?
Yeah, so it actually surprised all of us. So when we arrived, we were not aware that we were the only community that hadn't actually already had programming in place. So the other 3 cities have had programs for 15 years or more, 20 plus years, had already been doing strategies. Now, there has been a shift and change exactly what certain programming looks like and how we can build on evidence-based approaches. And what we learned and what we heard was that we have done something pretty unique that will hopefully build a really strong base to what we're attempting, and that is bringing organizations, bringing stakeholders to the table from the get-go. Oftentimes programs are implemented and then people are hired in to that program, and then work on bringing more people to the table to really make it community-driven. And so we've had a really unique start where we've been able to do that piece. And so really the next steps is we will be bringing one of the national entities that is really the consortium of all these different programs, Maryland, Tennessee, they were all over, as well as the CDC working on their public health approach. So many of them still use that base of the public health approach. And then prioritizing. So it's very specific to the community. We look at the data and we look at the needs. So we did a community needs assessment that they sent to us that was identifying factors that play a role in helping reduce violence, and then factors that might be in place that actually harm violence reduction strategies. And this was a surprising thing actually for a lot of us. We hadn't looked at some of those things before or thought about them in ways of how they impact violence in a community. For instance, alcohol density. That we don't have an ordinance or anything in place that limits the alcohol density in a community. And upon looking at that data, we found that we were more than double the national average. And so little things that are there things that we can work on that we know just help improve and thrive the community, and things that we already have placed and how can we strengthen them. So currently looking at our data, looking at our needs, one of the things that we're missing is this street team, is this team of credible messengers that we can have in place that are trained to be able to interrupt conflict, be able to respond to violence, mediate those situations, but also be in the community to really understand what needs are needed, and be that liaison for us organizations to be able to look at ways that we can assist in making that happen. So that will be our first strategy, is looking at what we are missing, and then in the long term continue to build on what is here and what is working to make sure that we're not working in silos. We're not wanting to recreate any wheels here. And we want to strengthen all of that. And the more coordinated we can be, the better it will be. So looking at what's missing, which is this team, and then continuing to build on that.
When you say alcohol density, what does that mean?
Yeah, so we found that really interesting out of all of them, of that an ordinance in place limiting the number of liquor stores or places where you can buy alcohol within a range of a community. And I mean, I don't know that any of us at the table when we were reading that were didn't even think about how that might contribute to the health and thriving. In partnership with how many grocery stores where you can also then purchase healthy foods, right? And what that looks like. And so the density within a certain area was double that average. So something that we plan on diving into more and looking at that. But as we were gathering data, that was one of the surprising things that I hadn't thought about, how it impacts the health of the community.
So have some communities instituted, it would have to be at a city ordinance level, not a county ordinance level, but at a city ordinance level, limitations on alcohol and alcohol sale?
Yep, they have. And we looked a little bit into some of those pieces, and there's lots of different ordinances that can be helpful. Looking at ways also with budgeting on city and or county level, where we're looking at the data, looking at ways that we can also distribute funding to social service-based entities, so that more of that preventative approach. And looking at ways that we can start supporting prior to violence occurring. How can we assist and help, and is that percentage make sense, right? Are we really funding a lot of reactive measures, and are we really helping fund some measures that we can prevent some of those things? So a lot of organizations, they actually brought up some approaches that we were doing that have been helpful in looking at ways to make those changes and improvements to policies, procedures, and budgeting, and that we had been kind of looking at a smaller level within just our own organizations. So that was reassuring as well, that we were on that right track.
I know that the district attorney had a team that went to look at the street team approach. There was a lot of studies in it. Ultimately, I think that they went in a little bit different direction, really focusing on more youth than adult. But are you asking or thinking that at some point there might be an ask to fund an adult version of that street team?
So I will never, like my whole career is about children and families, and investing in children is never bad, right?
Mhm.
It's never a bad thing. However, our approach was really looking at what's missing. What are we not doing that could be helpful? And when really looking at that and doing that study from that point in time and looking at the group violence, that we really were on par with national averages of our group violence rates. And then again, in this method of community violence, right, it's looking at the community approach. One thing too, like a definition of youth that is used within the CDC is actually up to the age of 24. So while this grant is youth and community violence. So it's looking at a little bit different approach. It's looking at, again, that public health approach of addressing social determinants of health, meaning we are going to be able to help our children by making sure the homes and the communities they're going home to, they're going back to, they're walking through to get to and from school are safe and thriving. And so we're taking it back one more step. We're going to that root cause of what is really spreading this violence epidemic, right? So we're taking it one more step back, and the hope is that we do get some sustainable funding to continue this approach. It is very complementary, and it very much is addressing a need that we don't have. It's not necessarily overlapping while we're going to see those, Topeka is the smallest big town, it is, and there'll be some opportunities to have a situation where the team that is in a CVI approach is looked at as being very intensive. As a matter of fact, another Department of Justice grant really states that youth programming, like this is great, youth programming is always necessary, but this isn't the grant for you. Like we're looking at a more intensive approach. And that's the gap we're filling is that approach. And definitely we'll need support to sustain that beyond what this grant is providing at this point, which also then goes to build that trust and commitment within our community. And as this grows, it only seems logical that there'll be those complements where someone might not, it might be a youth on our team that is approached and brought onto that caseload because they've committed violence or been a victim of extreme violence. But we might come in contact as we're in that community with someone who maybe hasn't reached that, but they definitely could use some support. And we hope to be able to have those partnerships where we can then pass that child, youth, family onto another organization who's able to commit to that. So it's really filling a gap here.
I appreciate that you're going out and engaging one-on-one and getting information from the different neighborhoods. An observation is that much of the violence in Topeka or Shawnee County is not random. It's known individuals that are interacting with each other or having disputes with each other. Is that consistent with what you might be finding on an engagement level?
Yeah, so back when the first time we did some assessments, that we were on par. We were on par with that. Less than half of 1% of our population was committing nearly 40% of the violent crime. However, we also know that there's an overlap of different social determinants of health factors that play into this role, right? And when we talk about groups, I've often heard during this too, it's like, well, if we know it's, 1/2 of 1%, like if we know these certain people are committing it, why aren't, we able to arrest them or things like that? And it's a generalization of, we know this group of people was likely responsible for this retaliation, and so therefore the approach of being able to be within a community, changing the norms of that community, and being able to then break that group mentality up by providing resources and opportunities, but also by addressing those that we can identify, like if they're in the correctional system, right? We have a partnership there as well. What can we do prior to them coming out? What kind of interventions can we start to make sure that when they are released, that same cycle is maybe not the most prominent thing on their brain at that point, right? Being able to intervene at different levels in a more intentional approach.
I note that Teresa Fisher with our health department is a part of this engagement. Were you able to utilize some of the data and information that the health department collects, our community health improvement plan, our community health needs assessment, into your work that you're doing as part of Civic?
Absolutely vital. Yes, it's absolutely vital. And as a matter of fact, one of the components of this recent grant was a requirement to have involvement of the health department, and actually because of the timing of when we found it, it just was not reasonable for that turnaround, and Teresa was very committed into assisting in this process. And we found that across the country, that was also one of the things that makes this very unique, is most other of these organizations are housed out of the health departments and have departments dedicated to public health and safety. And so that involvement has been vital because, again, being data driven, being able to make sure that we're intentional and not just guessing, right? Like, we need to ask people what they need. We need to find out what people want to have happen within their communities, but at the same time, being able to start that is by looking at that data. And that community health needs assessment is very vital in collecting that. We did have that additional survey asking more specific violence-oriented questions this time around, but the hope is to continue that discussion to see what components can we maybe just make a part of what we're looking at day to day in our public health strategy.
Okay. Questions?
Yeah. Quick question. So earlier you referred to group violence and community violence. Could you kind of just a little bit define the difference?
Yeah, absolutely. Yes. So the group violence initiative that we looked at really was focusing on the fact that the group dynamic, right? We know that this population of people who might belong to a group, really utilizing a law enforcement approach as well of identifying what groups are in which communities, what the relationships with other groups and communities are, to be watchful of when there are situations and then react to them. So that was an approach that we had looked at back in 2018, after 2017 being our highest year of homicides at that time. And we really had a lot of people at the table, and we're looking at working through that approach. Fast forward to now in the state of where our community kind of is, knowing that that youth were impacted greatly. While we still see these trends of it being a retaliatory and in some cases more familiar consequences of relationships, we have been able to also get more data on a national level of programming that has been impactful for a long term. And this public health approach has been really utilized in the last several years, is being, like I said, not pushed, but is being driven with CDC, NACHO, even the Department of Justice, and federal administration. So there has been task force created on a federal level looking at these approaches. So the approach of community violence is then going in, and instead of focusing necessarily specifically on that retaliatory impact just back and forth, is addressing needs of a community and letting the community thrive and change the norms within that, so it's more of a sustainable change. Does that make sense?
Yeah,
Okay.
I think so. Thank you for that. One other question is, it seems like
and this is totally anecdotally, I don't have any evidence here, but like, it seems like a good percentage of our crime in general, not just violent, but also property crime, is centered on, you know, drug and alcohol abuse. And so either, whether that's people who are under the influence committing violent crime or people who are involved in the sale of drugs, that, you know, does this take any kind of a focus into, like, you know, meth or something like that to try and, you know, curb some of that violence as a result of drugs and alcohol?
Yeah, so no, really good question. So mental health and drug abuse treatment is key. It's going to be a key component of looking at ways that we can be sure to offer timely and an effective treatment, right? So looking at those gaps as well, because it does play a component into health. We're finding that there's a lot of barriers to accessing those things, and it's a range of things. Sometimes they were questions we asked on this latest survey, and finding that a distrust in the systems was a big key piece that came up over and over again. And so being able to, while we might not understand what that distrust means, identifying people who can then go into the community and really find out, what's this distrust? What can we do to build this relationship and break this barrier so you can access the care you need? That's one piece. But other barriers including, you know, unfortunately we have, you know, sometimes really high wait times or limited beds. And if someone is waiting, you know, 6 to 8 weeks in order to get treatment, you know, the trauma approach, that trauma-informed way of looking at how people respond and act is you get rejected a certain number of times and you just stop, right? And you move on, and you can't wait, and I need to continue what I'm doing to feed my family, right? So if we're addressing those root causes, how can we build this system to be able to respond better? What can we do by you know, really budgeting our work and our funds to build up these social service systems that we know are needed in order for people to change their lifestyles or what they're doing, or to thrive and be better. And so that's another way of that kind of government approach of looking at how do we continue to build on these experts who are providing these services to people, and make sure that they're fully funded, doing what they need, having the resources they need in order to change that effect. So it's, again, that upstream approach to things, and that's kind of what we're looking at as well, but it's a key component for sure. We were finding a lot of people, for instance, when they're released from jail, right? Like, it might be a requirement to start this program, and this program. But if we have limited number of beds, you might be on a wait list for 3 months. And if you're just getting out of jail, you have no income, you know, you're gonna have to wait 3 months in order to begin treatment or this. You have to feed your family, you have to feed yourself, and you might result back to things that you know are going to get food on the table. And so being able to provide that and look at ways that we can collaborate and fill some of those needs to prevent that from occurring.
Great, thank you.
Thanks.
Anything else?
Yeah. You know, I'm sure drugs and alcohol have a huge impact on crime. But I want to go back just a little bit more. How many of these people they're causing the crime, how many have dropped out of high school? How many, you know, the moms that lose babies, how many have dropped out of high school?
Yeah, we have that data actually. And our actually high school graduation rate is close to 80 to 90%, as a matter of fact. And one of the things though that we can do is be able to overlay some of that data, which isn't necessarily something we've done a whole lot of. On a state level, we have that data we can break down. We recently received access to a program that has about 10,000 data points to it that the CDC has used as technical assistance for us. And so we will be able to start overlaying some of that to look at that as well, because access to education, our third grade reading level scores. As we know, the data in our community shows that we have a very low third grade reading level score. How can we address that? Like, what are some gaps that we need to look at and fill? And I think the more partnerships that we bring in and be able to form some of these even subgroups to address different components of these social determinants of health will help give us a bigger picture on that.
Yeah.
But you're right, it's multifaceted. There's not one thing.
Yeah, I realize the graduation rates are actually up, but how proficient are they?
Exactly. And I think, during our community needs assessment piece, those kinds of things were a part of that evaluation as well. So there are tiers, even access to childcare. We often, and we're hearing a little bit more about this, right? Like, childcare is infrastructure. We have to be able to have a safe place for children to go so that parents can go to work and it be accessible and affordable. Not, some of our data shows that families are spending almost a quarter or more of their income on childcare, which is that reasonable for someone to go making $7.25 an hour if a quarter of your or more is going to that childcare just to get there? And the gap that we have in I think some of the recent data that I saw, there was only 4 actual spots, 4-point-something spots of childcare space for every 10 children. So in order to get people to be able to go to work or go to classes or do those things, how are we looking at this on that broader level of how they intertwine and really impact each other on a broad level? So you're absolutely right, it's multifaceted, and we're looking at many levels of that.
Anything else, Danielle, you want us to leave with, or as
Is anything, team?
I mean, believe it or not, it is May, but we are already formulating and thinking about your budget for the 2025 year that has to be finalized in August. So as we go into the budget cycle, as we hear from the health department, from law enforcement, from mental health, Vallejo, are there things that you would want Civic to have us have on our radar?
Yes, absolutely. So Civic has really filed these grant applications as a coalition. The YWCA of Northeast Kansas has been our fiscal agent to house this funding. We will eventually be hiring some positions from this recent grant. However, there are many other sustainable things that would be very beneficial to be able to expand upon and to be able to sustain long-term past these grants, an initiative that is looking at violence reduction strategies from a neighborhood level approach. And we very much hope that as budgets are being looked at on city and county level, that we're really looking at how invested are we in these social services, addressing our unsheltered, addressing our mental health, addressing our substance use, addressing domestic violence, and addressing the violence in the community funded with the investment of that, and really being able to leave it to the experts that are being able to dedicate that time and energy, but providing that funding towards those approaches. And I think we'll see an investment back into our community of thriving when we're able to do that. And the hope is that you see that investment in the work that Civic is doing, and to be able to allocate funds to that public safety approach moving forward as a long term. So very much hope that those other pieces that are so vital into that work as well are also identified as being really important pieces to this.
All right. Appreciate that. Thank you very much.
Thank you.
We are at public comment. Are there any individuals wishing to address the commission?
Good morning.
Morning.
Henry McClure. We've got a JETO meeting coming up. And how lucky to have my county commissioner head a JETO. Let's look at this like lawyers. I'm not one, but I sure grew up in an industry that's filled with lawyers. I grew up in a legal family. My dad had a master's degree in tax law, then got a doctorate degree. My grandfather was a judge. So let's look at this legally. So I've asked you, and I'll make a core request if that's what it takes, but I need you to look at this like a lawyer, because I think you're my lawyer today in this case. You were elected because you're a lawyer, probably. There are a lot of people that went to the ballot box and said, that guy's a lawyer. I'm voting for him. The county needs a good lawyer. Not that we don't have one, but I think he's my lawyer too. I really do. I think he's my lawyer. I think his job is to watch you guys, not represent you. But I want to know why economic development my Pizza Hut deal couldn't qualify as economic development. So what I want, and you're my lawyer, you answer, you hired Go Topeka to be your contractor. They're not going to do anything I want. I'm the guy that wants to take their money away. They don't like me. And what I really want to get it down to, that's the reason they didn't give me money. Because I don't like Henry McClure. And I just want to break it down to that. It's my gut feeling. It's my gut feeling. This guy does not like us. I don't support him. And that's not economic development. But what I do want to know, so let's follow the money. There were $1.1 million in grants, gifts, and scholarships, which is not economic development no matter what. We didn't hire them to be the United Way. We didn't expect our tax dollars. So as a lawyer, I've made an open records request, and I hope your lawyer said he'd look into it, but I want to make sure that your contractor should have to fork over the information of why the $1.1 million was economic development. And then giving a sewer to Pizza Hut was not economic development. We got to break it down to that. And I need you as my lawyer, my county commissioner, head of JETO. You should be here helping the little guy. For me, it's all about, we're income drivers. We're the developers. Our deals create jobs. We create income to the community. We're the guys that make you money. Now, Chuck Doltmeyer has made a lot of rumblings about Lawrence Bay. I have too. I'll never figure out how the county let the city put GO bonds on that land out there when they hadn't paid taxes in a couple of years. How could you put specials on land that's delinquent? Why would you do that? That's not good stewardship of our money. And breaking it down, yeah, your stewards. So what, the city doesn't know what they're doing? You guys have to be the smarter people. No, you can't put bonds. We're not going to allow you to add specials on properties that aren't paying their specials today. That's not prudent. And all this stuff, between the city and the county, we got to start really looking for accountability. It's wrong. It's not economic development to give your contractor $3.5 million to go out and say they're doing economic development. Why don't we just change the whole playing field? one of the fellows over at the city at one of the Jetto meetings said, oh, we're opening up Pandora's box. Well, Pandora's box is the $1.1 million that went to all these gifts, scholarships, you know, the United Way. You're better off doing the little deals. You're better off helping the Chuck Doltmeyers of the world. You're better off figuring out how to help the Sterling Scotts of the world. You know, what was really amazing, I'm sitting down with a guy that owes the county almost probably $8 million in back taxes. And he's used to be the head of the contract, you know, he was chairman of the board of your contractor that doles out the gifts. And his idea to help the Whataburger and Chick-fil-A was to open up the development agreement that was a year old, redo it, and then borrow money from his bank. That was the day we quit talking. But I tell you, I need to be more organized. I really do. I need to bring a lawyer on staff at McClure Real Estate. I really do. And turn my hobby of better government into a full-time job. That's what I need. So if there's a young person that wants out looking for a job here, I'm creating jobs today right here. But you need to be my lawyer today. And we need to find out if the public doesn't want the new Pizza Hut to come to their community, and you don't want the Chick-fil-A and the Whataburger, actions speak louder than words. But we're doing it wrong, it's not fair. I'm a small businessman, and I'm gonna make it my business to get to the bottom of all this, and I need your help. You're my lawyer. You're my county commissioner. You happen to be the head of Jetto. You wield a lot of power. So do it. Thanks.
Thank you, Henry. Any other public comment? Any administrative communications? Commissioner Mays?
Nothing for me.
Commissioner Riplin?
Nothing here.
All right, then here, nothing else. We're adjourned until Thursday.